My fieldwork was completed at a skilled nursing facility in Muskegon. It was done at a facility that really is geared more towards longer-term care, people that are more deconditioned, people that really need a lot more assistance and skilled care. So that setting was something I'd never been a part of before, and it was really eye-opening just to see some of the behind-the-scenes stuff that I had never been a part of. So the facility itself typically saw anyone between 50 years old and older. I think somebody was in there was like 45 after having had their knee replaced, I think is what it was. So typically the conditions that you see are going to be related to rehab for a CVA, just age degeneration, deconditioning from pneumonia to maybe some sort of procedure that they've had done. The gentleman I'm going to talk about for my case study, I'm going to name him Jim. He is a 64-year-old who had a CVA. I don't really know how long ago, but it's believed that he was there probably at least 8 months. And he has a left CVA, so his deficits are on the right side. He presents with what is believed expressive aphasia, so he's really hard to understand. He's got slurred speech. Really hard for him to formulate the words. However, not to come out of his mouth. Not necessarily to get the words into his tongue. That's not the problem. He can formulate the thoughts. He can formulate what he wants to say. He just can't get it out. So with that brings frustration for sure. He gets really mad at the therapist for not understanding, and they do what they can to work with him. Giving him a chance to talk and trying to reiterate what he's saying, but he gets really frustrated with them. So he has no real obvious plasticity or spasticity, so he tends to just always sit in his wheelchair like this. So this implies that he's got some trunk control deficits, weakness, issues with that. He complains of pain in the right arm, so in his shoulder and his arm and his hand, and they've had x-rays done. They're working on getting an MRI, but they don't really know what that pain is from, other than, it could be just because it's always on it. So it could be start of a subluxation. It could be what the CODA I work with is thinking is a shoulder-hand syndrome, otherwise known as complex pain. Oh boy. Complex regional pain syndrome is the other thing that is the same as the shoulder-hand syndrome, and she thinks it could be that. So the MRI will hopefully help to determine a little bit more of that. But he has a family. He's single. He doesn't have a wife or a girlfriend. He does have adult children and 4 grandchildren. However, they live a couple hours away, and so he doesn't get to see them. And with his inability to really communicate, he doesn't talk on the phone to them. I don't know if he texts or if they, have some other way of communicating. However, he's pretty much on his own living at this or staying at this facility. So it is believed that he does have depression, or at least signs of being depressed. During a treatment session that I observed, he talked about, what's the point? There's no reason for me to get better. And so obviously that's an issue that therapy has to every time they go with him to see him, they have to convince him to have therapy. So he is a high refusal patient. He's also a Med A patient, so he has certain insurance rules that they have to really work hard around, trying to get him to meet all of the minutes that he has to have. And he's also a really high rug level. So he, aside from the aphasia, really the during my observations, what they did is they worked with PT and OT together, because his tolerance for therapy is very limited, not only by motivation maybe, but just physically it's really a lot for him. He's able to sit up in his wheelchair with no real problems, like I said, aside from the leaning, but getting him just to standing definitely is at least a modest assist, if not a max assist. He can assist a little bit, but he really requires a lot of assistance from somebody else. So he Was on the arm bike the first day, so it was a lot of just basic strengthening, cardio, range of motion, and his leg kept hitting the arm part of the bike, and he became really mad that it kept hitting it. And so they brought a mirror over, hoping that would help with his positioning. And he was sort of in tune to what was happening, but he really just became so frustrated. He shut down, and he refused to continue, and he tried to basically get off the bike and go back to his wheelchair. So he was a little impulsive, and therapy stopped, which is the right thing to do. And they took him back to his room. And several hours later, we did try to go back to make up the minutes that were lost. So, but again, he refused. So the second time the third day of my observations, I had the opportunity to go back and see him, and he was in a better mood. He hadn't really been participating a whole lot with therapy, but like I said earlier, he did have to be convinced, and part of that convincing revolved around what's the point. But because I was there, he was willing to work, and he said he was willing to help me learn, which was really a nice thing, and I was glad that I could be the motivator that day. That particular day, we had conversations about the women's basketball game that ended in a buzzer beater that was just crazy, and he became so excited he started crying, which was really a unique situation to be a part of, because I didn't know how to respond, and even the coda just didn't really. She's obviously seen that before, but we just let him have that emotion, and he probably has emotional lability, so he really can't necessarily. What he wanted to do was be excited, but it came out as crying. During the intervention the activity that we're doing, he became so excited and so proud of what he was doing. He also began to cry. So that was just a huge learning experience for me, to say the least. So so for his intervention, she took a washcloth, and first of all, he's leaning like this, so she talked about his posture and really had him sit up and pay attention to that. And even throughout the activity, she had him do the same thing. But so he would put his hand down, but it requires him to kind of manipulate it with his other hand. So he went back and forth. I think she had him do that like 20 times total, with any breaks in between. And it was definitely not very fast. It was very slow, and slow motions like this. So this way, and then she had him going big, wide across this table. And so he was in his wheelchair, and in front of him was his like bedside table. So that's what we used. So she was working on making sure his feet were positioned. And then we also did large circles. So really working on balance and leaning, a little bit of working on pressure relief a little bit too. He hadn't really talked about the pain that day with his shoulder, but this was a good exercise, I feel, to opening up that joint and really moving that around. So that was, between the bike and that's all I really saw. But he was an interesting man. He and I hit it off the first time that I was there with him, and that was fun for me. It's just kind of why I chose him for this case study. So he probably would really benefit, in my opinion, from doing more ADL activities that could incorporate PNF diagonals or weight bearing. But with motivation being such a difficult thing for him, even just trying to incorporate more things that he would appreciate and like, or things he'd like to get back to. And even if he may not get out of this facility for quite a while, it's still important that to be client-centered. So I don't know how much I really saw of that, but his interventions and his goals may be really a lot not there yet. So maybe they'll progress to that at some point. He is probably going to, if he continues to be a refusal and his goals are not being met, they're going to need to probably drop him from OT, unfortunately, or OT services are going to not be provided to him. I know PT was also having the same issue. So hopefully it doesn't happen for him. He definitely could benefit from having the skilled care and the rehab that he's getting. So hopefully, that's able to be continued.